morning and a very happy Ramadan to one and all. My name is Dr. Aisha Nilofer and I'll be hosting the fourth of the 10 webinar series by Aster Volunteers. And today, the topic is going to be sleep hygiene during Ramadan. Due to COVID-19 last year, we have all adapted to a situation that is the new normal for us. Aster Volunteers have been at the forefront of this situation. Our efforts have resulted in touching over 2 million people's lives in the form of food ration kits, PPE kits and medical camps. All this was possible thanks to Aster Volunteers. So if you would like to register yourself as an Aster Volunteer, please log on to www.astervolunteers.com. Ramadan is a holy month decreed by God to celebrate spirituality, fasting for over 14 hours a day with a small window period to eat. It's only natural that our sleep pattern will be changed due to the lifestyle change in Ramadan. We might often find ourselves lethargic, tired, and often find ourselves less concentrated. So today we have Dr. Sunil Vyas, who will throw light on the subject at hand. I'd like to remind the viewers that the chat box is open for any queries that you might have so that we can help you with. Without further ado, hello Dr. Sunil Vyas.
Good morning.
How are you doing today?
I'm fine.
Could you give us a basic explanation on what we're going to do today?
Yeah, so we'll be talking about sleep hygiene, specifically in Ramadan. So sleep hygiene is a very important thing to have, because if you don't sleep well, everybody knows it's part of the healthy lifestyle. So a good sleep means sleeping for at least 7 hours at a stretch, and with good sleep hygiene, good sleep, you can concentrate better, you have a very healthy lifestyle, you can do your routine activities well, and you can have good concentration. And so sleep hygiene is of paramount importance.
Alright, so can we start from the top? What are the physiological effects that you can find during Ramadan?
Yeah, so in Ramadan specifically, when somebody is fasting nowadays for almost more than 40 hours, so and your sleep generally gets affected because you get early up in the morning. So the physiological changes which happen is that when you are fasting, by the end of the fast, you feel very tired, you feel very dehydrated, exhausted, tiredness. So whatsoever, it becomes very important if you have good sleep and you manage your sleep in such a way that you don't feel tired and you can do your routine activities, day-to-day activities along with fasting also.
Alright, so how is your sleep pattern changing because of fasting?
Yes, the sleep pattern changes because you sleep, probably a lot of people during the Ramadan fasting are sleeping at around 11 o'clock, 11:30 in the night, and they get up at 4 o'clock in the morning, do their sehri, take bath, go for a prayer, and then probably a lot of people engage in a lot of religious activities, or some people, a small subgroup, might be sleeping after taking a nap of around 1 hour or so before they go to work. And then other people who don't do that, probably since in Ramadan the working hours are reduced, so they can come back from office and from their workplace and take a power nap or around 1 hour or so. And that is how it is advisable to manage your sleep, because if you don't sleep for at least 6 to 7 hours in 24 hours, then it becomes really difficult for us to concentrate, to maintain a good healthy lifestyle.
All right. So when we fast during Ramadan, we usually take 3 meals. So one is after when we break open the fast, that's iftar, and then we have the dinner, and then we have the sahri right before starting the fast. So what would you say how the food patterns change and how it affects sleep during Ramadan?
So food patterns also play an important role in determining how good your sleep could be, because if you take a lot of spicy, a lot of heavy food late in the night, and then you go immediately to sleep, you don't drink adequate water. So if you ask me, and the best way of maintaining good sleep hygiene is that to eat at least 2 hours prior to sleeping, and then have drinking adequate water, and to avoid a lot of spicy foods just before sleep. So that would be the best thing. So I would suggest that if somebody can do that, a lot of my friends and colleagues do this, that after breaking the fast, just before, after breaking the fast and having iftar and between the Tarawih prayers, they have a meal, crisp meal probably, so that they have a lot of time by the time to go to sleep, so that they can have adequate time to drink water and and help the food to digest also.
So probably eat like 1.5 hours, 2 hours before
Yeah,
your
definitely
bedtime.
1.5 hours, 2 hours before you sleep.
All right. And what do you suggest about Sahri? Should you have a lighter food or a little heavier?
That depends upon every individual. I would suggest that because early in the morning you can have, even if you have heavy food, it's not a problem because you have a lot of scope for it to digest, and it's early morning and you will be going for work, so you have a lot of time to drink water, to drink, probably not drink water immediately, but over a period of time to digest that food. So even if you take a heavy meal in the Sehri, it's not a problem at all.
Okay, I'd like to remind everyone the chat box is open for questions. So if you have any queries, please drop in. And this show is hosted by Aster Volunteers. And if you'd like to register yourself as a volunteer, please log on to www.astervolunteers.com. Also, doctor, another thing I'd like to ask is, do you suggest a small short breaks of nap or sleeping at a stretch?
I would suggest, specifically in Ramadan, we should have small breaks in nap, because you may not be able to sleep on a stretch for 7 hours. A lot of people sleep by 11, 11:30 and they have to get up at 4 o'clock. So, it's only 5.5 hours of sleep at a stretch in the night. But they can catch up on that sleep in the afternoon or after early morning between 5 a.m. to 6:30 a.m. or 7 a.m. or in the afternoon between 3:30 to 4:30, because that's the most crucial time. People after fasting for almost 8-9 hours might feel a little bit more tired and exhausted. So, you need to energize yourself. So, you need a power nap or a break nap during the afternoon.
So, also there's something, the government has decreased our office timings, but still there are many people, they find themselves stuck in traffic right before iftar. So, they might be they might be experiencing sleeplessness also. So, any tips to counter sleep deprivation?
Yeah. So, the best way to counter sleep deprivation is to have a good sleep. So, if you have sleeping well in the night, there is uninterrupted sleep of at least 5.5 hours, then also you can remain fresh. But since they are fasting, so sleepiness and little bit things may be there. So, the best thing would be to avoid just driving or reaching home before iftar. I would suggest them to reach earlier, at least 2 hours before iftar. Reaching home would be the best thing to do, because by the time it's late in the evening and you're almost late in the fasting time, it will become very, very difficult for them. While driving, they may feel more sleepiness, more tired. So, it would be advisable for them to come reach home early.
All right. So, what would you like to say as conclusion?
As a conclusion, I would suggest that since Ramadan is an holy month and a lot of majority of them are fasting and they have sleep deprivation, but this is somehow we need to manage our sleep deprivation in such a way that even if we are able to sleep only for 5.5 hours in the night, we need to catch up our sleep either early in the morning or sometimes in the afternoon to make our sleep pattern better, and at least to have 7 hours sleep in 24 hours, because sleep is a very, very important but quite a neglected thing in our lifestyle. We think eating healthy and working and makes our healthy lifestyle, but walking, but sleep is a very, very important factor which plays a role in maintaining a very good healthy lifestyle.
All right. So, you're trying to say that find a sleep pattern that works for you.
Works for you.
So we can reap all the benefits.
Yeah. So, you need to, an individual needs to plan his sleep in his own way, specifically in Ramadan, because they are sleeping less, as I said before. So, to catch up on their sleep either in the afternoon or early in the morning would be the best way to do, and to have a good sleep for at least 7 hours, as I said, to individualize their own sleep pattern.
So, on behalf of Aster, we'd like to thank Dr. Sunil Vyas. Dr. Sunil Vyas is working as a respiratory medicine specialist in Aster Hospital, Qusais. He is trained in managing, diagnosing as well as treatment of several diseases such as asthma, chronic obstructive pulmonary diseases, sleep disorders, lung cancer diagnosis, just to name a few. He's also trained in medical thoracoscopy as well as diagnostic bronchoscopy. So, could you tell our viewers how to reach you further?
Yeah, so you can reach me. I am working at Aster Hospital, Qusais, Dubai. I am a specialist pulmonologist and I deal with sleep disordered breathings. Along with the other diseases which Dr. Aisha has mentioned. You can reach me at Qusais. I am working in the outpatient department as well as I look after inpatient patients in the hospital.
All right. So please feel free to share this video. We have also covered several other topics such as anemia, pregnancy, breastfeeding in Ramadan, also on COVID-19 too. So thank you, Dr. Vyas,
Thank you for having me.
For your invaluable sharing your invaluable information as well as your time, and also thank you viewers for your support. So we all wish you a very happy, blessed Ramadan. So this is Dr. Sunil and Dr. Aisha signing off.
Thank you.